ClimaWATCH is an interactive tool designed by Mathematica to help communities explore how heat waves impact health and magnify health inequity. The tool synthesizes and summarizes data on heat and humidity, social and environmental determinants of health, and Medicaid claims to facilitate heat vulnerability assessments and tailored heat action planning. The dynamic displays help officials identify communities with high exposure to heat waves, high susceptibility, and excessive heat-related health issues. ClimaWATCH shows how heat waves have concentrated geographically at the national, state, and county levels, across the heat season, and as the thresholds used to define a heat wave are changed. With weather data analyzed from 1981 through 2021, ClimaWATCH shows how communities' exposure to heat waves has increased over time. For example, in 1998, an El Niño year, 1,683 U.S. counties experienced 978 heat waves, which averaged 4 days in length and peaked in June. By 2010, one of the hottest years on record in recent times, the U.S. saw 40% more heat waves and multiple smaller peaks earlier and later in the heat season. In 2021, although fewer counties across the country were affected by heat waves, more unacclimatized northern populations were exposed, causing unprecedented fatalities. Bringing focus to the unequal impacts of climate change, ClimaWATCH also shows how counties with and without heat waves differ in their vulnerability based on demographic, social, environmental, and infrastructural risk factors. For example, in Georgia, counties with heat waves in 2021 had almost triple the minority population of those without heat waves at 41% versus 15%. They also had higher socioeconomic vulnerability at 75% versus 58%, and 50% more impervious surface cover, which measures how much of a county's urban area is covered by hard surfaces that absorb and store heat. Differences in exposure and vulnerability can lead to increases in a range of health issues. ClimaWATCH analyzes healthcare use and spending data among one of the most vulnerable populations in the country, Medicaid beneficiaries. The tool algorithmically quantifies excess healthcare use and spending that can be attributed to heat waves by comparing healthcare visits during or shortly after heat waves with those during periods without extreme heat to parse out background levels. Nationally, in 2019, even counties experiencing just a few heat waves saw excess healthcare utilization to treat heat stress, and the resulting excess spending was disproportionately concentrated in blind or disabled beneficiaries. ClimaWATCH can be customized to specific user needs, for example by including hyperlocal measures, additional climate-related exposures, and forecasting to boost planning and preparedness. Explore the tool for yourself to learn what ClimaWATCH can tell you about how heat waves impact health in your community.